Good morning, doctors. My name is Dr. Cristina Barahona. I'm going to talk about electrocardiography. Electrocardiography is a transthoracic interpretation of electrical activity of the heart over a period of time as detected by electrodes attached to the surface of the skin and recorded by a device external to the body.
Okay, so this is a tutorial on the left side of the heart. So it's following on from the tutorials I did on the right atrium and right ventricle. And there's a bit of overlap in terms of the structures in the left and right sides of the heart. So I'm not going to go over them in massive details again, so you can refer to those tutorials to clear things up a little bit more. So we'll start with the left atrium and then work into the left ventricle. So the left atrium, externally you can see this appendage here. So just like on the right side you've got this right atrial appendage or auricle, you've got the same on the left side. So you've got this left atrial appendage. And then if I rotate the model round posteriorly, you can see these four veins entering into the left atrium. And these are the pulmonary veins, and they carry oxygenated blood from the lungs back into the left side of the heart. So the function of the left side of the heart is to pump blood out to the rest of the body, oxygenated blood to the rest of the body. So I'll just rotate the model back round again and we'll talk about some of the internal features of the left atrium. So similar to the right atrium, the left atrium has two divisions. So it's a little bit smaller than the right atrium, but it's actually thicker. The walls are thicker. So the posterior division of the left atrium, just like the right atrium, has smooth walls, and this aspect of the right atrium, this posterior aspect, receives these four pulmonary veins. So the anterior half is continuous with this auricle, this left auricle here, and this half of the left atrium contains the rough ridges, so it's got the musculi pectinati. But unlike the right atrium, there's no crista terminalis. So you've got the smooth posterior surface of the left atrium and the rough, muscle-ridged anterior surface, or anterior half, which is continuous with the left auricle. But unlike the right atrium, where you have this smooth muscular ridge delineating the two halves, which is called the crista terminalis, you don't have this in the left atrium. So I've just sliced the heart in half, and we'll take a look at the wall of the atrium. So the wall dividing the right from the left atrium is known as the interatrial septum. And remember I showed you the oval depression in the right atrium. You've also got this oval depression on the left side, because remember it's a remnant of the foramen ovale, which is a hole in the interatrial septum which allows blood to flow from the right to the left side of the heart, bypassing the lungs, which are not functional at birth. So those are a few things to know about the left atrium.
An electrocardiography is used to measure the rate and regularity of heartbeats, as well as the size and position of the chambers, the presence of any damage of the heart, and the effects of drugs or devices used to regulate the heart, such as pacemaker.
An EKG, also called an electrocardiogram, is a test used to measure the normal electrical signals of the heart. First, small electrode stickers are placed on the arms, legs, and chest in a specific location as seen here. Once the electrode stickers have been affixed to the patient, then cables are attached to these electrodes that connect the patient to the EKG machine. For some patients, we may have child life assist by playing with a child to distract them and allow the cables to be more easily placed. The EKG machine only reads signals. It does not cause any discomfort to the patient. Once the cables have been affixed properly, the electrical signals from the heart can then be read and printed out on an EKG to be read by the physician. Once the EKG has been taken, then the leads and electrode stickers can be removed.
In a myocardial infarction, the ECG can identify if the heart muscle has been damaged in specific areas, so not all areas of the heart are covered. The electrocardiography device defects and amplifies the tiny electrical changes of the skin that are caused when the heart muscle is polarized during each heartbeat. At rest, each heart muscle cell has negative charge called the membrane potential across its cell membrane. Decreasing this negative charge towards zero via the influx of the positive cation, Na and Ca, is called despolarization, which activates the mechanisms in the cell that cause it to contract. During each heartbeat, a healthy heart will have an orderly progression of a wave of despolarization that is triggered by the cells in the sinoatrial node, spreads out through the atrium, passes through the atrioventricular node, and then spreads all over the ventricles. Here we can see how the heart works during the electrocardiography. This is a test that ascertains rises and falls in the voltage between two electrodes placed either side of the heart, which is displayed as a wavy line either on a screen or a paper. This display indicates the overall rhythm of the heart and wiggleness in different parts of the heart muscle. A dedicated electrocardiography machine will usually print onto graph paper which has a background pattern of 1 mm squares with bold divisions every 5 mm in both vertical and horizontal directions. At a paper speed of 25 mm, a small block of an electrocardiography paper translates into 40 ms. 5 small blocks make up one large block, which translates into 2000 ms. Hence, there are 5 large blocks per second. A calibration signal may be included with a record. A standard signal of 1 MB must be moved the status vertical 1 cm, that is 2 large squares on electrocardiography paper. Here we can see the electrode label and the electrode placement.
The heart is a beating muscle that pumps oxygen and nutrient-rich blood throughout the body. Each beat is stimulated by electrical signals that pass through the heart muscle or myocardium. In order to examine the function of the heart, a doctor may perform a test called an electrocardiogram or ECG, also referred to as an EKG. During this test, electrodes are placed on the chest and recordings are then made of the heart's electrical signals. Sometimes the electrodes are also placed on the arms and legs. The electrical signals follow a set pathway through the heart, beginning at a spot called the SA node, which is located in the top right chamber or atrium. The signal then branches out through both the right and left atria, which contract and push blood into the lower chambers or ventricles. The electrical signal also passes into the ventricles via the AV node and then travels down the tissue that separates these two lower chambers. Finally, the signal travels back up the ventricles, which contract and pump blood to the lungs and body. Variations from the normal electrical pattern may indicate damage to the heart due to a heart attack or heart disease. Often a patient will be required to perform a stress test during an ECG. A stress test usually involves walking or running on a treadmill at progressively increasing intensities while recording an ECG. This test allows the doctor to examine the heart's electrical activity during the stress of exercise.
Here we can see the PR interval, the PR segment, the QT interval, the QRS complex, the ST segment. Thank you very much.